Mr. Woods, you specifically referred to specific challenges in Limerick and demand patterns in Limerick. Could you elaborate on that? I mean, Limerick typically has or at least consistently the highest numbers of people on trolleys. And you mentioned demand patterns in the accident and emergency there. Could you elaborate a little bit on that? What you mean by...
I referred, Deputy, to the bed capacity in Limerick vis-a-vis the population was what I was referring to at one level there, and that was assessed and known to be beneath what was required, and that additional 100 beds we're referring to, and indeed earlier developments in Limerick that have supported capacity like the ICU and the ED and dialysis and the Lieben building have all been about growing capacity and improving capacity. So there has been a demand-supply mismatch very clearly, and those 100 beds will support addressing that. But I did also say, Deputy, that hospital beds are not a solution in isolation in the health environment. In fact, excess focus on hospital beds as against community investment will lead to an ineffective situation. So I think from our point of view, we also have to focus in on investing in community services around Limerick. The community intervention team that's working opposite the hospital there and out into the community is very successful, and supporting that and expanding community type initiatives would be very useful. There are initiatives underway within Limerick and across the wider region out into Clare and indeed in Nenagh relating to cataracts that are helping support the health of the entire population without bringing patients into Limerick at all. And I think they are also investing in more of that kind of work in our Model 2 hospitals in Ennis and Nenagh would be very useful. And there are some outreach clinics running in primary care centres from Limerick, and we need more of that to support GPs and bring specialist consultant advice to GPs at a local level without having to refer patients to the hospital base.
Obviously, or not obviously, but the previous Minister for Health accepted that there was a necessity for more outpatient procedures to be carried out in the Model 2 hospitals. You've referred to that in the case of cataracts. Are there any other procedures in which there's an increase in the provision of in the Model 2 hospitals? In Ennis, in St. John's, in Limerick and in Nenagh, and I ask in the specific context of Limerick being the most consistently overcrowded hospital in the state, and if we're going to continue to channel the vast majority of patients from the Midwest region into the most overcrowded hospital at a time of COVID, it is a catastrophe waiting to happen, and the clock is ticking.
So, Chair, if I take that, the answer is yes to your question, and there are specific proposals which we're considering as part of our approach to the coming months and the winter period from the UL group. It would include things like the integrated care programme for older persons, so projects which would be about supporting older population to stay at home and indeed out of hospital, and that is about investment in staff, including geriatricians in the community, working cross hospital and community. There are other proposals around surgical assessment, around radiology. These all fall to be considered in the next few weeks as part of our response to winter. So there are proposals to make more use of Nenagh and Ennis and support Duradoyle in that context, and St. John's.